Welcome to In the House. My name is Mark Shiver. So excited to have a return guest, Dr. Tim Reeder, representing the good folks down in Pitt County. And Representative Reeder, Dr. Reeder, thank you for joining us again here on In the House.
Happy to be here. Thanks very much.
Sorry, it took us for a little behind the scenes report that folks really probably don't care about, but Zoom is updated, and it's sometimes all this technology is for old folks like me isn't as easy to handle as we'd like it, but we're set, we're going, and I'm excited because I have some things to ask you that I think our listeners and viewers are going to really enjoy hearing about. Now, the big doings down in your part of the world, tell us about this job announcement you had last month, I believe it was, earlier this month, with a large number of employees.
Yeah, the district, things are going very well. We had a great job announcement. Boviet, which is a Vietnamese solar panel company, announced a big investment in Pitt County, about a $294 million investment with 900 jobs. So
Wow.
that's exciting news for the area. Good paying jobs, manufacturing jobs, and again, just broadening the industry that is in Pitt County. And we know that if you get a job that stimulates the economy, there's other effects for that, right? If you have a job that you're well paid for, you're going to buy a house, you're going to spend money locally. So all of those are really exciting news.
Yeah, that's a lot of jobs. You know, one thing that struck me when I heard this announcement was that sometimes people tend to lament the fact that we have job announcements and they might be more closer to an urban area like Charlotte or Raleigh or Asheville or Greensboro, whatever. But right down east there in Pitt County, this is good for that region, wouldn't you say?
It really is. And what we know that the jobs aren't just locally in Greenville. We know that there's a workforce watershed. So we will have people coming from many counties to go work in these jobs. And so it's not just good for Pitt County and for Greenville. We know that there will be people coming from other counties surrounding to work at this company. And so I think about job creation more from a regional perspective, is that any job growth in the state is good for the entirety of the state and the region in which we're at. One of our large employees, Thermo Fisher, which is a manufacturer of pharmaceuticals, they employ 2,100 people in Pitt County, and they come from 26 counties every day to work here. Yeah. So again, I think that regionally job creation is really important.
Now, let me ask you this, kind of inside baseball, so to speak. When you're in the stages where this sort of thing is being talked about, do you feel like there's enough attention that's being paid to, hey, wait a minute, guys, you know, we're going to need some road action here. We're going to need some infrastructure. That's a lot of bathrooms, you know, when you're adding 800 or 900 folks to an employee role. So how do you guys work through that and feel comfortable that, yes, this region at this time is going to be able to, you know, meet those infrastructure needs?
That's a great question. And economic development, job creation, job growth is a long-term investment strategy. So this plant actually took over an existing plant. So there was a manufacturer who left less than a year ago. So it was nice that they were able to turn around that quickly.
Yeah.
It's in our industrial park. So there was already infrastructure in that area. And so I think one of the things that we talk a lot about with our regions and communities is, what businesses are you able to attract? What's the infrastructure that exists, or how do you build into that? You know, one of the projects we had earlier this year that we were able to help in the budget was upgrading the water infrastructure for one of our other manufacturers in the county. And what I've come to understand as I've been in this role is that job creation isn't just about giving incentives and attracting a business. There's requirements for sewer and water and power and waste. All of those things are important. And so what we as a community, what others do is, how do we set up the environment for businesses to come in? And what are the environments, or what are the businesses that are appropriate? One of the nice things that we have in Pitt County is Greenville Utilities, which is our big wastewater plant and our power company. They are able to deal with some pollutants in the waters that other municipal treatment plants aren't able to do. So that's a competitive advantage for us in that area.
Well, good. It sounds like you're definitely on top of things there, and I know this is going to be a really nice benefit to the folks down east. And one thing I wanted to ask you about, kind of off topic, is you are in your first term, and you went through the long session and had to, deal with all that goes along with that, and the creating of the budget and all of this. And then you come into the short session, and it's supposed to be, well, we're going to tweak the budget and go home, but it never, as long as I've been here, it's never that way. There's always something that comes up. But how does it feel being a member in your first term? Compare what you were feeling during the long session as to how this shorter session feels in terms of your role and what you want to get accomplished. And is it the same? Is it just more of the same?
It's definitely different. I now have a little bit more understanding of the process. Starting as a freshman in that long session, although we had some orientation, nothing really can prepare you for that legislative activity. And so that was a much longer run. And for most of us freshmen, we just didn't understand the process of how do you get bills heard? How do you negotiate with other members? How do you get your priorities into the discussion points? So now I have a little bit more knowledge of that. I think what's a little different in the short session is, how short is the session going to be? And what are the topics that we are going to be able to address? We passed a number of bills in the long session that made crossover that are available for discussion. There's other bills that we can, or other policies that we can still insert in the process, even if they technically didn't meet crossover.
Right.
What I've learned is that there's rules and there's ways around the rules. And I think when we heard some reports about a lot of money in the budget, I think that got everybody excited, both constituents, advocates, and members, about, oh, do we have more play in the budget? I think that those initial reports were a little bit overly optimistic, and so there's not as much money. So I think that will hopefully temper some of the discussion here.
Yeah.
But the reason we run, the reason we get elected is to do policy work. So I'm really looking forward in this short session of how can we advance some good policies for the citizens.
Well, speaking of that, you can come down here, and when you're not in session, I always tell people that when y'all are in session, it's like Black Friday at the mall. And when you're not, it's like Sunday morning at the mall. You have a few mall walkers, but in comparison, it's certainly different as far as the frenzied activity. Do needs for your constituents kind of taper off, or is that something that's always ongoing, and your job is to help people all the time, regardless of whether or not you're in session?
The work never stops. And one of the things that people think, oh, well, if you're not in session, you're not doing work. And that's just not true. We still do a lot of work in the district. And so meeting with advocates, meeting with individuals, meetings with groups, we still do that all the time. And when we're not in session, it actually gives us a little bit more flexibility in time, because we're not up here rushing around. When I talk to constituents and I teach advocacy, I always say, it's great if you want to come up to Raleigh, but when you're up here, I might have 15 minutes in between a meeting to talk to you. But if we can get a cup of coffee back in the district or back home, we can have an hour-long discussion and really understand and advocate for those things that are important to you. But, I've been at the Boys and Girls Club, I've been clerks of courts, we've been meeting with people back home and up here in the district or up in Raleigh.
Yeah.
And sometimes from the legislative perspective, when there's not a lot of committee meetings because the session really hasn't gotten really revved up, we can have discussions with other bill drafting or legislative analysis or other folks about things that we're working on. I mean, last week I had a great hour discussion with Jay Ludlam, who runs the Medicaid program, about ways with which we can use that program to improve health and how can we make it more efficient and effective to take care of our patients. And having an hour dedicated of his time is not something that would be possible if we were going really busy in the session. So that was a nice conversation.
Now, I don't normally put people on the spot in these interviews, but I feel like I have to based on what you just said, and not in a bad way, but I want you to give us an honest appraisal. Take your legislative hat off and put your doctor's hat on. We expanded Medicaid as a state. I'm just going to put you on the spot. How's it going? If that's okay for me to ask.
You've already asked. So, I think that what we are hearing is that we are signing people up for Medicaid more quickly than we anticipated. So I think that is a good thing. If I take off my legislator hat, or even leaving my legislator hat on and my physician hat, we know that insurance coverage is important for access. And so this is going to help a lot of people out. I mean, I took care of a number of patients in the emergency department who came with very advanced diseases or very sick because they couldn't get care earlier on in their disease. Wow. I mean, there was one patient I remember who had a thyroid condition, and the medication that she needed was not that expensive, but she didn't have a way to pay for it. When she couldn't get her medicine, she was admitted to the intensive care unit several times over the course of a few years because she couldn't afford that medication. So instead of paying, $100 a year for her medication, we were paying $100,000 a year in hospitalizations. And now she will qualify for Medicaid. That's a good investment for the state.
Good. Well, I know that you can see that like probably nobody else in the legislature can, because you're a physician, and so it's good to have that perspective, and it's good to hear that it's helping people. Speaking of that, you had a bill passed in the long session, and it was originally a standalone bill, and like so many bills end up being folded into the budget just for convenience sake. So tell us a little bit about the Hospital Violence Protection Act. Now, when you were here before, we talked about this. Yeah. It sounded like a really good bill to protect folks that work in our hospitals, because frankly, Representative Reeder, I didn't have any idea the level of harm and violence that was being levied towards folks that work in hospital facilities and such. So you got the bill passed. How's that going?
Well, it was something I was very proud of to pass in the long session, and it was through a lot of hard work from a lot of people. And it has a couple of provisions. One of them is to require a law enforcement officer on the hospital premises, if you have an emergency department. There was some reporting about collecting data of violence, because what I learned, what prompted me for the bill, was healthcare is the most dangerous profession that's out there. 72% of all the non-fatal workplace violence act happens in healthcare. So it's a very significant and common issue. And so we passed the bill to require law enforcement for hospitals to record information and data on the acts of violence. And so there's some reporting requirements as well. We've heard from constituents from hospitals that they are struggling to meet some of these requirements. So while I appreciate their difficulty of doing this, I think at the end of the day, I want to make sure that we are attending to the doctors, the nurses, the technicians, the therapists who are entrusted to take care of our patients. And I know that if you're worried about violence or you've been assaulted or injured, that diverts your attention from the patients. So we're having some ongoing discussions with the Healthcare Association and other hospitals to say, how is it that we can help you meet these requirements? Because I certainly don't want to penalize them, but I also want to make sure that they're doing everything that they can to protect their employees.
You know, I would think that along with myself, the vast majority of people who just heard your response are stunned, because here you are going to somebody who's providing care to you, and yet there's violence being, directed towards those very people who are providing care. That just doesn't make any sense. 72%, I mean, wow, that's just not right.
It is. And I think the one concern that I've heard from hospitals and healthcare systems is that there's a shortage of law enforcement officers across the state. And so, as municipalities and sheriff's departments are struggling to hire and find officers, this is one more workplace demand. So I appreciate that concern, and I think that's why we're going to have a conversation actually later today. How do we help mitigate some of that pressure?
Yeah. Well, I've been to the doctor right much of late, and I never thought about hurting anybody. So I just, it's hard to believe that there's such a need like this, but thank you for working to take care of our medical professionals, because that's certainly very, very important. Now, you mentioned some things about healthcare that I wanted to ask you about. You've been having some conversations during this time of late with folks about the needs in North Carolina for mental health care. And I've always looked at that need as kind of like a giant black hole, in that there is such a great need for folks to have care regarding mental health. And yet it's like, oh my goodness, it's such a large, almost overwhelming problem that how do you even begin to tackle something like this?
Well, I think that is absolutely right. If this was easy to fix, we would have fixed it already, right? Oftentimes these complicated issues are complicated for a reason. And what I know as a physician and as a legislator is that the mental health crisis is increasing. It is devastating, especially for our young people. And we right now don't have a good system with which to address all of those issues that were there that were really exacerbated during COVID. And so we have the opportunity, we've allocated significant amount of money for the mental health space in a lot of different areas. And what I want to do is make sure that the money we're spending actually improves care and leads to more efficient and effective care. One of our challenges is that a lot of the money that we have available that we got from signing up for Medicaid expansion, it's not recurrent money. So we need to figure out ways with which to build infrastructure to help address this. So one of the things that I keep asking provider organizations, the LME, MCOs, the managed care organizations, how is it that you're going to help build infrastructure? How is it that we are assuring that what you are doing is efficient and effective over the long term, so that we just don't invest some money that gets wasted? And I'm confident in our healthcare system. We are not always as efficient with the resources that we allocate. So those are some of the things that we're looking at to make sure that we're doing this wisely. We know that we need workforce. We need workers. We know that we need facilities, whether it's mental health urgent care, whether it's respite care. We need some infrastructure and for some facilities, and we need workers, but we also need to make sure that the programs that we are funding are doing and getting the outcomes that we expect.
I have a very quick story that happened several years ago to someone who's close to my family. One of their children, late teens, early 20s, college age, had a need for mental health care. And they went to one of the hospitals in the Triangle area. I'm not going to name any names, but to make a long story short, they didn't have enough beds. This child of our family friend was a female. They admitted her, and she sat on the floor in like a common area, like where a nurse's station is. And it was told us there were like 5 or 6 other people also on the floor, camping out, essentially, waiting on a room to physically open up because they didn't have enough space. And our friend's daughter was frightened, on top of the mental health issues that were going on at the time. Here she is on the floor with a bunch of strangers who also had some mental health things going on. And it was an experience that when I heard about it, it was like, this can't be real. This was probably in 2015 or whatever. So maybe 10 years ago. And it's like, how are we still at a place like this where we don't have enough, room to accommodate folks? And so I share that to say to you that I don't envy you as a person involved in policy or as a physician trying to deal with this, because it is a need that's not going away, and yet it's a need that's urgent.
It really is. And I know that the emergency department is the safety net for a lot of communities. And what I also know is we try our best in the emergency department to provide a therapeutic environment, but the emergency department is probably one of the least equipped place to deal with someone who has an acute mental illness. It's loud, it's noisy, there's not as much privacy. And we have a real need for more inpatient facilities, or sometimes some, maybe not complete hospitalization, but is there some respite care, some other alternatives? One of the things that I was able to participate last year in, which was really exciting, is that we're going to have a new behavioral health hospital in Greenville. Right now, if you are a child or adolescent, there is no place in the East where you can be admitted to the hospital if you have a mental illness. And so we end up transferring a lot of those up here to the Triangle area. And when you try to think about how we're going to get follow-up care, how we're going to involve parents in those hospitalizations, that's really difficult when you're not physically located together. So I'm really excited about the new behavioral health hospital that ECU partnered with to build, and it's under construction. I drove by it last week, and the concrete's down. They were putting steel up. It's really exciting.
Wow, that is exciting. And I could talk to you for another hour because I find your answers compelling and fascinating. But I know you, as you said, you've got a meeting, and this will just give me a reason to invite you back so we can talk some more about these. They're really real issues that hit people where they live. So I want to thank you not only for being a guest on In the House, but for the work that you're doing. I think for whether you're a first term member or, this was your 10th time, you're doing good work. And I want to say thank you as a citizen of our state. Thank you for what you're doing.
Well, thanks for having me, and I will come back as much time as your listeners can tolerate me. I think the work that I'm doing up here is really energizing and invigorating for me personally, because one of the things that's sort of baked in my soul as an emergency physician is that we like to try to solve problems. And that's what I view this legislative process about. what are the problems, the issues that our citizens are facing, and how can I work to bring some solutions to that? And maybe it's not ideal, maybe it's not the totality of the solution, but how is it that I can use the levers that we have, the influence, the money to try to solve problems? And I think that's what the role of government should be.
Absolutely. Thank you, Representative Dr. Tim Reeder, representing the fine folks down in Pitt County. Thank you once again for being our guest on In the House.
Thanks, Mark, and let me know when you want to do round 3.
Okay, we'll do it. Thank you.
All right.